All right, happening today, it's Go Red for Women Day in the midst of American Heart Month. Advocates across the country raising awareness for women's heart health. And joining us this morning is Dr. Barbara Srichai, cardiologist and director of Women's Heart Health at MedStar. Thank you for being here.
Oh, thank you for inviting me.
So tell us why cardiovascular disease is such a big concern.
Well, it's the #1 cause of death in both men and in women. I think we recognize that for men, but I think women are often unaware. There's a lot of misconceptions out there. So a lot of women who actually are high risk may not feel like they're at risk at all. And so it's important to bring that awareness so that they advocate for their health.
Yeah, and how does heart disease differ between men and women, as you mentioned, and why is knowing the difference just so important?
Well, I think women present a little bit differently than men. We think of, what they depict in the movies. If you're going to have a heart attack, you're going to have this crushing chest pain. You're going to know that's what's going on, and you're going to have to go to the hospital right away. We often say that women's symptoms may be a little bit different. Women actually, though, do have chest pain. I think we tend to discount it more because we think this couldn't be a heart attack. I'm too young. I don't have any risk factors. Women don't get heart disease. And so women tend to, as I mentioned, discount it. They may have other symptoms that they're more aware of, and it kind of can be misleading both for them and for physicians who treat them, because it leads them down the wrong pathway. So as I said, I think the biggest thing is being an advocate for yourself. I guess the other thing is that there are different ways that heart disease presents in women compared to men in terms of what the cause is. I like to describe a lot of times plaque buildup in your arteries and almost like a blister. In men, a heart attack is often heralded by when that blister pops. Except when this happens in the blood vessel, it closes off the blood vessel. And women get that as well, but there are other causes of heart attacks in women, including spasms like you get in the muscle where the muscle clamps down, but when it happens in the blood vessel, it clamps down, maybe temporarily, but it closes the blood flow, and that may cause symptoms. In addition, there's a condition called SCAD, or spontaneous coronary artery dissection, that we see much more in women than men, and that's where there's just a spontaneous tear in the artery. And that may also help explain why sometimes when women present with heart attack, they present a little bit differently than what we think of with the classic presentation.
Dr. Barbara, there's just so much important information here, just a lot of it. Tell us, what are some good, easy ways that women can start taking care of their heart health, like maybe eating, what not to eat, what to eat?
Yes, so we talk about choosing your foods carefully, and controlling your risk factors, even knowing what your risk factors are. Women who have risk factors are more likely to develop heart disease than men who have the same risk factors. I think the biggest thing we can do is watching our diet and our exercise. Women who exercise are significantly less likely to have heart attacks compared to women who don't exercise. And even so, you don't even need as much exercise as compared to men to decrease that risk. So that, as well as smoking, and then with diet, emphasizing a plant-based diet, trying to minimize the amount of red meats compared to fruits and vegetables.
Wow, and just when I thought I was going to skip the gym today. Dr. Barbara, thank you so much for being here today.
Thank you for inviting me.
We'll be right back with more.